Now, clinical trials are not always favored because we talked about before, low awareness amongst the general public. How can physicians and medical professionals help patients see clinical trials as an empowerment tool?
I mean, so the thing is, I would say many of the changes that I've noticed for last few years, or I would say for last decade or so, has been really coming from the patient. Like Jeff, you're doing this like powerful patient advocacy group. So all the changes that I am seeing happening is really coming from the patient themselves. The patient who got benefited by participating in clinical trials are the ones who are so motivated to make a change in here. So I would say there has been some apps that have been developed, so like there's in terms of the cancer, there are many platforms that you can open in your iPhone or the Android, and then you can click in, okay, so this is my age, this is my gender, this is the cancer type I have, this is where I live, where is the clinical trial that I can potentially participate? And now the patients can freely email somebody like me and say, hey, Dr. Lim, I think that I may qualify for a clinical trial. Can your team talk to me? So that's such an empowerment tool. In some way, so in previous era, I would say, or even in current era, in some of the communities, patients are afraid that you doctors or you companies with the big power are trying to make me as a guinea pig, and you're trying to make money out of me. So that was more of a clinical trial concept that I've been kind of hearing from the community over a period of time. But now I think the new generation patients are much more smart, and then they wanted to take control of their own body, their own disease. And I can tell you the clinical trial will be the best way for you to take your own control of the disease. Because, if you don't participate in a clinical trial, you're going to be only following what's been developed like 2 decades ago. You're never going to be able to expose yourself to something that's new. And for example, the cancer immune oncology, where we eradicate all these cancers by, boosting up your own immune system, is such a one tremendous example of such that if your patients didn't believe it in and then participated in, they would have still continued the same, chemotherapy that gives you a lot of toxicity and ended up, not working anymore. So something, I would say this is more of a joint force. And then maybe one thing that we should add into the picture is the trust with each other, that the doctors can trust the patients, that they can be really participating willingly and then trying to really participate even as early as the design of the clinical trial. And some of the cancer trials are actually having the cancer patients participating and tell me, yay, nay, oh, that's not gonna work, you need to consider this and all that, to the point that patients also needs to trust doctors that